The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with chronic pain. My first guest is Dr. Shallenberger. Dr. Shallenberger, welcome to the program.
Randy, it's great to be here.
Now, before we get into today's topic, because this is a big topic, tell us about your center, because you do more than just treat pain patients.
Well, that's true. We do everything that's alternative in nature, in the sense of combining traditional medicine with alternative types of approaches to health.
Okay.
And my goal is to prevent people from getting sick. And we treat people that get sick too. But what I'm really interested in is getting people in there that are healthy, that feel good, and that just want to be that same way in 20 and 30, 40 years later.
So you get all types of patients.
Yes,
I mean, you get the people that want bioidentical hormones, the longevity crowd, and pain. What percentage of the practice is pain? And would you like to see more pain patients?
Yes, I really love to see pain patients, because if there's anything that makes a doctor feel really good, it's taking people out of pain. That's the worst thing that could happen to anybody. I've learned that
right?
Real quick. Probably half my practice is pain patients.
Really? You know, I've talked to doctors. You know, our show airs nationwide, and they confide in me they don't like the pain patient. Why do you?
Well, I like it because the things that I do, it takes the pain away.
Okay,
and most
really?
doctors don't like pain patients because there's nothing that not
it's a
much,
crabby kind of a patient.
It's not that much out there to help the patient except give them drugs. I mean, you're not really taking care of the problem. I can take the pain away.
Is that right? Now, we're going to have to put disclaimers all over the show that results are typical, not typical, but you, I mean, the results are there. I mean, you're getting a lot of results.
That's right.
Are you using traditional medicine and alternative therapies? Because I know, is that right?
Well, yeah. I mean, figure it this way. One is you have pain is its own problem.
Okay.
Now, we use an alternative treatment to solve that. But you figure the other thing is the person that has the pain, if they're healthy and they're vibrant, they're going to be much more likely to respond to any other therapy that I do. So we kind of work on both aspects. I want my pain patient to be healthy, and at the same time, then I'm going to go ahead and give them something to take away the pain. And that combination just is marvelous.
Now, backing up for just a moment, your background, training, I guess you were involved in emergency medicine.
Well,
how'd you make this transition?
That's how I started out. I started in emergency medicine because I remember when I was younger, it was exciting, it was interesting, and what I always loved about emergency medicine is you get to go straight to the cause of the problem. And
Okay.
you know, if somebody came in with a gunshot wound, I just didn't give them pain medicine and send them home. We actually went to find out what was causing the problem, literally fixed the problem, and off they go, cured, and it's a done deal. And that's what I did for.
So you feel like you're doing that even today in a way?
Well, that was the idea. And,
Interesting.
After about 8 or 9 years of doing that, I decided, I'm going to get involved in just general medicine, and that's when I got involved in general medicine. That's when I really came through to me, Randy, that in most situations, doctors are unable to really get to the cause of things, and it just made me very curious. I just really wanted to know what causes us to get sick. And that's
Okay.
it, in the late 70s, that's when I got involved in alternative and anti-aging medicine, because those are the things that really drove me.
Okay, so you started out traditional medical doctor, emergency room medicine. You thought, and I'm paraphrasing, of course, that you could have the most impact there. Do you think you have more impact now doing what you're doing?
Oh, undoubtedly. There's still emergency docs out there taking care of emergencies, so that's just fine. But this whole area of preventive medicine, where you actually literally take healthy people, there's nothing wrong with them.
Yeah.
And you initiate a process that keeps them that way until they're old.
Interesting. Okay. Now, we invited you on the show to talk about prolozone therapy. Okay. And by the way, what is this used for? What areas of the body of pain is this used for?
It's used for literally any area of the body where you have pain.
Okay.
We do feet, we do ankles, knees, just work your whole way on up. Obviously, anything along the spine, we do a lot of necks and spines and low backs in particular, shoulders, elbows, wrists, hands, fingers, any place that's teeth. I do teeth, I do TMJ, I do anything where there's pain.
With pain. Okay, so let's talk then. Let's start with the back.
Okay.
Back pain. Maybe herniated disc, or they've tried maybe injections before, they've tried different things, medications. At what point do they see you? And who is your typical patient that comes in for the back pain? At what point do they go to you, and how do they hear about you?
Virtually all the time. People come in to see me after they've already tried many other more traditional sorts of therapies and they haven't worked. So,
like what, chiropractic?
Well, like maybe chiropractic, like rest, like physical therapy. Some of them have had surgery. A lot of my patients have already had surgery, and the surgery either didn't work or didn't work well enough.
All right.
Then there's certain kinds of neurological procedures where patients can go have nerves ablated and such like that. But most of my patients are people that have pretty much exhausted the traditional or conventional way of treating their condition, and it's not working, and they're just stuck on pain pills.
Now, in your area, would you say there's thousands of people that are in pain that don't have to be?
Absolutely.
Really?
Oh, yeah. If the average person out in the audience were to just think about the people he knows, probably going to find maybe half the people, a third of the people that he knows are in pain of some kind.
They just learn to live with it? Is
well,
that what it
they
is?
don't always talk about it. So
Okay.
They're not going to tell your friend that you're in pain necessarily. You're going to just sort of deal with it. But a lot of people have a lot of pain, and they just learn to live with it because they don't know what else to do.
Okay, so let's talk about let's start with low back pain. Okay, so it's called perlozone therapy.
That's right.
This is one of the phrases you coined. It's an injection with oxygen.
That's true.
I don't quite understand how it works, so help me understand.
Well, to understand how this therapy works, you have to understand what causes pain in the first place.
So what is it?
So what causes pain in the first place is decreased circulation. You got to figure, your body, when it gets injured, there's processes in the body that cause it to heal itself.
Okay.
And those processes are dependent on circulation. As long as you have adequate circulation to the area, that area will heal. So if I bang my shoulder, bang my arm on something, that area will heal. I fully expect it to heal, and it will heal. But every now and then, somebody wakes up and you say, you know what? I had an injury. This injury happened X months ago, and it's not healing. What's up with that? How come it's not healing? The answer always is there's not adequate circulation.
So in the case of low back pain, maybe a little arthritis or a herniated disc, not enough circulation?
That's right. If it hurts, there's not enough circulation. That's
Okay.
what causing the pain.
So take me through a typical patient comes in. Okay, so they have a herniated disc. It shows up on an MRI. What are you doing or it's pinching a nerve?
Yeah.
What are you doing? Are you reducing inflammation? What are you doing?
Well, we do all of the above, of course, but here's the problem. You get the injury, you have the problem, it creates swelling and inflammation. That swelling and inflammation impede the circulation. Without the circulation, they can't get rid of the swelling and inflammation, and it's a vicious cycle.
But isn't it just
They're
a matter
stuck
of
in that.
it bulging against the nerve that's causing the pain, or it's more than that?
No, it's not just that disc is bulging. Most discs get healed just on their own. You don't actually need surgery for it. If you can get adequate circulation in the area, but it's a vicious cycle. So you have to reestablish the circulation to the area, and that's what I do.
Really?
I inject into that area the things that the cells there would ordinarily get from an adequate circulation, like, for example, oxygen. That's the main component. That's what cells need to heal. In an injured area, you've got stem cells, you have blast cells. They're sitting there. They're waiting to do their job. They're waiting to fix that area. In order to do that, they need oxygen, but they can't get it because the swelling and the inflammation prevent the oxygen from getting in. I just shoot the oxygen right in on the area. And
what kind of oxygen are you shooting in?
I shoot it in the form of ozone.
Okay.
Now, oxygen that we're breathing right now is two oxygen atoms put together. We call that O2. That's the stable form of oxygen. That's why it's in the atmosphere. We breathe it. Ozone is something I have to make up in the office. What we do is we take O2 from a medical grade oxygen, and
from a tank.
Yeah, from a tank.
Okay.
And we pump it through a converter box. In the converter box, those O2s get broken up into O1s, and immediately they reassemble. Most of them back into O2, but a proportion of them reassemble into O3. So you have three oxygen atoms stuck together. Now that
it's like ozone.
It's called ozone.
It's more powerful, more therapeutic to the body?
More powerful. In fact, studies have shown that if you just inject oxygen into area, nothing will happen. You have to inject oxygen in the form of ozone, and that's when the miracle happens.
Really? Okay, so where else in the world, by the way, are they using this? And is this accepted?
The use of ozone in medicine has been used for over 50 years now, primarily in Europe, and which is where I learned it some 30-odd years ago. Right now, the new thing is using it for pain. It's been used for all kinds of other
working.
conditions.
I mean, are you seeing some?
It's astounding.
Are you surprised sometimes
Absolutely
at the results you're getting?
I'm surprised when it doesn't work. Every now and
Really?
then it doesn't work. And I just have to scratch my head and wonder why that is.
It sounds like an exaggeration. Okay, so somebody in back pain, neck pain, let's say low back pain. Okay, I mean, I can't help but think that they must say, how come my doctor didn't tell me about this?
Well,
why wasn't I exposed to this?
That's probably the question I hear the most often. And the reason is because it's new. I mean, I just developed this maybe 12 years ago. I'm one guy. I just developed this 12 years ago. We're trying to get the word out.
But there's other doctors that are using this.
I've been teaching doctors for the last 12 years in 2 seminars a year. And so we do have, several hundred physicians around the world now that know how to do this. But that's nothing. Most of the major cities don't even have a doctor that can do this.
Now, the Anti-Aging Society, the Longevity Society, they get together, hundreds of doctors, thousands of doctors. They look at these therapies as serious alternatives, right?
Yes.
With great results. Mm-hmm. Now, you say you're changing people's lives. How so?
Well, amazingly, I can tell you one thing. Pain is a terrible thing. It's a very terrible thing. And there's nothing that brings me more joy than to be able to take somebody who's in chronic pain, who has disabilities. I could tell you a few stories. And get rid of that pain. We see smiles on people's faces, and that makes it fun for me to go to work.
I mean, you lower the pain or you get rid of it in some cases?
Well, let me give you an example. I had a fellow that came in from Colorado. This was a guy who's 74 years old, and he's an old cowboy. Right. And the thing that gives him the most pleasure in life is riding his horse. But he had a pain in his groin that nobody could deal with, and that stopped him from lifting his leg up over. He couldn't get on the horse. Even if he had a platform to stand on, he could not lift his leg over to get onto the saddle. He was extremely upset. He had a beautiful old horse he trained all his life, couldn't ride it. He's now riding that horse. And after just several injections of this treatment, the pain is literally gone. He can lift his leg up, move it around. He's getting on his horse. He was really happy to tell me that he went to some kind of celebration, I think it was up in Pendleton, Oregon, where old cowboys get together, and he was able to ride his horse with some of the older guys.
I mean, do you have any stories where people are, without sounding, exaggerating, I mean, in walkers that don't need walkers, or people that couldn't get in and out of their cars, and now they could get in and out of their cars?
I had a lady came in from Boston. She was an ICU nurse. And she had been on disability for a year. She could barely walk into the office. Now, she wasn't in a wheelchair or anything, but she had had multiple surgeries. Her lower back was filled with metal. There was plates. There were screws in there. The x-rays was just unbelievable. She had severe low back pain. She had severe neck pain. And the thing that upset her the most is that her hand was going and she couldn't do her needlepoint. I mean, that's all this woman had left. She couldn't go to surgery. She was a dedicated nurse. That's all she had left was her needlepoint, and now she couldn't do her needlepoint. And that's literally
So how did she hear about you then?
I think
website, word of mouth?
Maybe the website, word of mouth. Most of my patients, happen that way.
Now, does she go to you very skeptical? I mean, this on a consult like that, she goes to you. She's an educated person. She's had these surgeries. What does she say to you? I mean, what do they say?
Most of my patients are not too skeptical because most of my patients, the reason they're in my office is because they've talked to somebody that had great results. That's why they're in the office. So they fully expect to get great results.
Oh, good.
Yeah.
So with her, okay. So she's in pain, spine pain, neck pain.
Yeah.
And what'd you do?
So we treated all the areas where the pain was.
So you just injected the area with ozone.
That's right, yeah. But it's more than just ozone. We also inject the area with homeopathic substances that reduce inflammation and swelling.
Okay.
We inject with homeopathic substances that stimulate stem cells and blast cells to do what they're supposed to do.
And there's science behind everything you're doing?
Oh, absolutely.
Okay.
Yeah. And then we put in vitamins and minerals. So, I'm putting in oxygen, vitamins, and minerals. I'm basically putting in what the circulation is supposed to take there. And what happens is when you put that in there, the magic is that the healing is happened, and then the swelling goes down on its own, and then your own circulation takes over, and I'm out of there.
So with her, how long did it take?
After about 3 treatments over a space of about 3 weeks, she was infinitely better. The numbness had gone in her
So what does
hand.
she say? What does she say? I
Well,
mean, how does that change her life?
Well, she walks with a big old smile on her face. Instead of hobbling, she's walking like a normal person. She's got a big old smile on her face, and she comes in and shows me her needle point. I mean, that's the kind of thing that I get to see, and that's why treating pain is so much fun, because you actually get to help people.
Now, we talked on the phone. Have there ever been people that, and I think you said this, that have been scheduled for back surgery? They went to you as a last resort, and they didn't have to have back surgery.
All kinds of people, especially knee surgery. I see do an awful lot of knees. Between backs and knees, that's probably 80% of what I do. Because that's the most common areas where people
Give me an
have
example.
pain.
Okay, so somebody's scheduled for surgery. What kind of surgery with the knee?
Almost every patient I get for knees is somebody that's scheduled for a total knee. Almost everyone I get.
Knee replacement.
Knee replacement.
Okay, so they're scheduled for surgery. And help me understand then. So what was being missed?
Well,
this person
the
is told
orthopedists are doing a fantastic job with knee surgeries. But any orthopedist will tell you if there's a non-surgical way to treat a problem, that's what they want.
Do that first.
Oh yeah, they're
Okay.
going to try their patients on anti-inflammatory medications. They're going to try their patients on physical therapy. Surgery is kind of a last resort. And what modern medicine is going to be learning in the fairly near future, there's already some published studies out on this. So this word is going to get out. It's not out right now. But what modern medicine is going to learn, that by injecting these substances right into the
vitamins, minerals, homeopathic
you
stuff,
can cause
oxygen.
the stem cells and blast cells in there to actually renew and rebuild the cartilage without surgery.
Interesting.
Yeah, so we do have people that...
So you have knees that cancel it, really, and they're back to normal?
Most of them are scheduled for surgery. They came in and they don't want
it's
surgery.
hard to believe. Understand that on my end, very hard to believe.
I could show you some
And
pictures.
people need to know this is a real interview. I'm not trying to side here with you, but very interesting. It's hard to believe that so you see these every day, you have them documented in your practice.
That's right. When I first started doing this, Randy, I was skeptical. I really didn't believe. I thought maybe this was a placebo or something.
Yeah.
And it's only been that over the years, I know it's not. And I could actually have x-rays then to see. And I could show you x-rays of a knee before and x-rays of a knee afterwards. And you can see that there's cartilage built up.
Really?
There. Yeah.
You can grow cartilage.
You can grow cartilage.
Is that right? Okay, now we've had traditional medical doctors, pain management physicians, board certified on the show. They do injections. How is their injection therapy different than yours? So somebody may be watching and say, I tried injections, and over time they stopped working or weren't as effective. What's the difference?
Well, the difference ultimately is the ozone gas that I do.
Okay.
And it also may have something to do with the homeopathics, but the biggest key element is the ozone gas. Because when I first started doing this, that's all I put in. I didn't put in any of these homeopathics or any of these anti-inflammatories. I just learned later on that they really amp up the healing process.
Is that right?
But early on, all I did was inject ozone in there, and it worked all by itself. So I know that is the principle.
Shoulders, knees.
That's right.
Back
Rotator
pain.
cuffs.
Is that right?
Rotator cuffs.
But once it's
carpal
gone,
tunnel syndrome.
but if a rotator cuff is worn out or torn, it's too late at that point, isn't it?
No, your body.
Really?
Yeah, if you were to go in there and look at that tear on the rotator cuff, you'll see stem cells and blast cells sitting all over there waiting to go. They just need to get what they need to do the job.
If an orthopedic surgeon's watching this, what could they say?
Well, if an orthopedic surgeon's watching this, they probably think that this can't happen because they haven't heard
So
of
they'll
it.
watch the show. We'll have medical doctors watch this show. What do you want them to know about this therapy?
I used to study orthopedics. I was an orthopedic resident. And so I've always liked orthopedics.
Okay.
But one thing I like about orthopedic surgeons is they're pretty pragmatic. If I get referrals from orthopedic surgeons,
Good.
but they're awfully pragmatic. If something gets rid of the pain, they're happy about it.
They'll do it.
Yeah. So if there's
Would
an
you
orthopedic
stack? Would you stack your results against any traditional pain management practice?
Absolutely.
Really?
Absolutely.
Naturally, no side effects.
Yeah. I mean, I got to tell you, half my patients are people that have been to chronic pain centers and, they're on all the medications and everything and they're surviving, but the pain's still there. We get rid of the pain.
Do you get frustrated that, you want to get this word out? It's hard to get out?
Absolutely.
It's because I guess it's can't be made by a drug company. It's not
Absolutely.
patentable. There's not big money in it.
I'm not sitting in my clinic all by myself, just treating patients. I teach doctors twice a year, 2 seminars a year from all over the world how to do this because I'm on kind of a mission. Everybody should have this available to them.
And it's called prolozone therapy.
Prolozone therapy.
Okay,
Yeah.
we're going to take a quick break. We come back and more. Take me through the process. I want to know what patients can expect. They're watching this: neck pain, back pain, shoulder pain, knee pain. What happens on day one? You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know about getting out of pain. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic: new cutting-edge therapies for the treatment of chronic pain. Okay. And your typical patient, are they 60-plus crowd? Because 60 is young today.
I would say most of my patients are probably in the order of 55 or older.
Okay. So do you have people, obviously as you get older, and if you have the luxury of being retired, things like bowling, things like hiking, traveling. I mean, do you have stories where people are back to their normal, horseback riding like you mentioned?
How bad is it when you've worked hard all your life to get to a certain point where things in your life are very good, and now you're suffering from pain, and that pain can stop you from doing the things you love.
Yeah, I'm sitting here listening to this. My father, a little bit of low back pain. Now he can't play tennis.
Yeah, exactly.
And then now from tennis, now he's saying I can't even bowl now. It's like gradually
it's a downward spiral. Is what you can't do this, you can't do this, you can't exercise because you can't exercise.
Do you hear
this
that? Is that a common?
Oh yeah, all the time.
Then you do the therapy, and they slowly get back to doing it.
The pain's gone. They're out there doing whatever they want to do.
It's hard to believe, though, that in your 70s that you can rebuild, what is it, connective tissue, cartilage? What is it you're rebuilding?
Well, yeah, it's just exactly that. It is ligaments, it's tendons, it's joint capsules, it's cartilage. Any area that's been damaged.
So the golfer, by the way, with the shoulder problem?
Yeah.
You have some of those?
I'm treating a lady right now. Now, she's a golfer. She loves to golf. That's her whole thing. She golfs like twice a week. And she hasn't been able to do it because her knees are bad. Her shoulders happen to be okay, but her knees are bad. She's back to playing golf twice a week again. I just saw her the other day, so it's fresh on my mind.
There's this phenomenon where golfers nationwide are having knee problems. You need to see those people. Is this therapy becoming more mainstream? Because I hear about it.
I think so.
I don't hear about this ozone therapy.
The Canadian FDA has just approved a study on ozone therapy for low back pain.
Okay. Now, what are the frequently asked questions? Okay, so they come in. What do they want to know every time?
The question, obviously, is it going to help me? Is it going to work? If I'm traveling from Boston or if I'm just traveling across state to get this therapy done, I want to have a sense for whether or not it will work.
Well, that's a tough one to answer.
That's the big question I get. And I tell them, if it hurts, there's a 90% chance that this pain will either be gone completely or gone so significantly that you can do many things that you ordinarily couldn't do.
And then they get their tickets from Boston.
And they'll send me.
Can you say that? That's a bold statement. That's a very big statement.
But I've been doing this for 12 years.
So you have that much confidence.
Yes, absolutely.
You want the pain patients.
Absolutely.
And so if somebody asks their doctor about this, they may poo-poo it or may not know about it.
Their doctor, in all likelihood, will never have even heard it. He'll have to go research it. But if they go to the internet and plug in the words prolozone, you get all kinds of patient testimonials, all kinds of patient stories. And they now. If doctors go to PubMed, which is the doctor study site, and plug in ozone, they're going to get hundreds of articles now on the effect.
So the science is there.
The science is solid.
But I think that what separates you, and I'm just making this observation, is that you're not just treating the pain, but you're putting people on anti-inflammatory diets as well, treating the inflammation.
Exactly.
And how important is that?
I think it's critical. What causes pain ultimately is a failure for the body to work. It's supposed to fix the problem. You get a herniated disc, your body is supposed to fix that. You tear your rotator cuff, you have internal mechanisms in your body to fix that.
A bulging disc, though, that's pushing against a nerve. You're saying that with this therapy, so I understand this correct, it can
shrinks the disc right back in.
Off the nerve. And can you prove that? Do you have any MRIs or X-rays in your practice?
Absolutely do.
Really?
Yeah.
And so
before and afters.
Would you love to see that?
Case.
Would you love to see these herniated disc patients?
Absolutely.
What about completely just no disc left at all? And that's why they need a surgery.
That's fine too. We do a lot of that.
What do you mean?
They call it degenerative disc disease.
Okay.
So patients will call up and say, I have severe degenerative disc disease of my neck or of my lower back, and the doctor's recommended a laminectomy, or the doctor's recommended a fusion or something. Mostly no.
So why? Why?
The number of patients I've actually sent to surgery has got to be no more than 5%.
Because you're puffing up the disc?
And I'm seeing the worst cases that you can imagine. I'm not like seeing the very brand new virgin cases that just went out and injured themselves. I see some of those, and I love to do that. But
that's a good point. Okay, so if somebody's been in pain for 15 years, can they be too far gone?
No.
Really?
Come in. Yeah. I virtually will promise them that their pain, if not completely gone, will be so substantially reduced that they'll be extremely pleased. That's how good this is. And I don't care if it's been there for 15, 20 years. I don't care how many surgeries they've had.
Okay.
Doesn't make any difference to me.
So the process, they call somebody watching this, and I'm being careful to say that I'm not endorsing you on this show. This is your opinion. It's very interesting, by the way. And I've done limited research. I mean, I think I believe the concept of what you're doing. But if somebody's watching this, where does it begin? They go to your website first. They call and make an appointment. Does it cost to see you?
Well, they can go to the website, and then there's a button on the right side there called prolozone therapy, and they'll learn a little bit about it. And then the bottom line is, come on in and let me do the treatment to you. It's painless. It's easy to do. It's completely safe. It's so safe that even though if you come into my office these days with litigation the way it is, you've got to sign about 5 or 10 different informed consents just to see me.
Okay.
But I don't have any informed consents for prolozone therapy because it's entirely safe.
Dr. Shallenberger, pleasure having you on the show. Very interesting.
Thank you,
Very interesting. I'm going to look more into this
myself.
So thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or point a friend of yours that's in pain in this direction, you can visit our website at wellnesshour.com. Just put in pain or Dr. Shallenberger and you'll find the interview. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.